All right, so everybody can see my screen. Perfect. Well, hello, everyone. Thank you for joining the webinar today. My name is Stephanie Lay with M.I.S.T Corporation. I'm an inside sales representative, and I also have Samantha Lewis, our project specialist, and one of our main template developers with me today. And then I also have Ashton Underdahl, our COO. We are excited that you're here today, and we can't wait to introduce you to our panelists. To warm things up, I have a few slides I wanted to present on here that do not know who M.I.S.T is, and then we'll hop into discussions with our roundtable. So our M.I.S.T story, our founder, Cindy Richardson, was an office manager of a family practice group who in the mid-90s embarked on a next-gen electronic practice management implementation along with 600 other providers in the area. Cindy quickly recognized the gap between the vendor and the clients and stepped in to fill on behalf of the community. The steadfast dedication to her community spurred the philosophy that will forever be ingrained in M.I.S.T. After incorporating the business in 2006, Cindy partnered with our now CEO, Jody Sinclair, in 2007. Jody's background in technology, healthcare, and networking, coupled with her passion to care for the client and partner at the deepest level, has allowed M.I.S.T to serve over 1,600 medical practices in the United States, Canada, and Guam. We create solutions to meet client needs, leveraging our clinical knowledge, innovative thought process, and next-gen expertise to bridge the gap with a focus toward maximizing efficiencies and improving workflow. Our target is to make a positive impact on your practice. We started as a next-gen client and from there became M.I.S.T Corporation. We became partners with NextGen in 2006, AthenaNet in 2013, and you can see have expanded more partnerships to better serve all of you. Our mission has and always will be to make a positive impact in the lives of our clients through our knowledge, innovation, versatility, and networking. So integrating technology within a medical practice is painful at times. Technology vendor goals aren't always aligned with specific needs of our healthcare providers. As a community, some of the challenges you might be going through are technology expense, extraneous overhead, changes in reimbursement, and that's actually what brings us together here today. And I will turn it over to Ashton to introduce each of our panelists for today's Clinic Pain, Clinic Reality Roundtable.
Awesome, thanks, Steph. So hi everyone, I'm Ashton. I'm the COO of M.I.S.T Corporation. For those of you who don't know me, hello. My journey in healthcare began in, let's see, when I was about 14 years old. I started at the Coeur d'Alene Brain and Spine Clinic in between gymnastics practices. Connie, the office manager, had me go to the basement and start converting demographics from paper into the next-gen EMR. She paid me $87 a day through the summer to get it done. That was my first healthcare job. From there in college, I was the president of my class at Northern Arizona University in the dental hygiene program. And every week while I was there, or every weekend while I was there, I would fly to Seattle for M.I.S.T and convert paper records into electronic ones for the Southlet Clinic. So my team would drive over from Coeur d'Alene and meet me there, and we'd convert records all week long. I've been with M.I.S.T 11 years now and essentially held every role in the company, which has allowed me to meet these wonderful panelists. Laura and Alicia, thank you for being here. Our third panelist wasn't able to make it today, so we have the lovely and wonderful Samantha standing in for her. But without further ado, I'm going to hand it over to Laura for an introduction.
Hi, good afternoon. My name is Laura Hackett. I'm the Director of Clinical Systems at Core Physicians. We started our next-gen journey in 2002. We have 239 providers on the practice management side and 164 using the electronic health record. We started working with M.I.S.T before. I had left on hiatus for a couple of years to just better my career as a project manager for a reseller for NextGen, but I came back to Core as their project manager and started working closely with M.I.S.T. They had helped us get on Dragon, naturally speaking, the network edition, and then we quickly moved over to Dragon Medical One after I started working here. So we've been closely aligned with M.I.S.T for approximately, I believe it's like 12 years. We utilize M.I.S.T for our e-filing as well as our template edits for our monthly enhancements. So they've been a great partner with us and feel like they're part of the team. So that's a little bit about what we do.
Awesome.
And we are sorry.
Okay, fine. The feeling's mutual, Laura. You're definitely part of our M.I.S.T family here. Thank you so much for taking the time to hang out with us today. Let's take a moment to meet Alicia Rutherford, our second panelist.
Hi, I'm Alicia. So I work at Heritage Health here in North Idaho. We're an SQHC, and we have 4 different medical clinics, as well as mental health, dental, and psychiatry. I have been here about 2 years. Prior to working here, I've worked with M.I.S.T and Ashton for many years. I don't even know how many years, a while. In my role at Kootenai Health, which is a community-owned hospital in North Idaho. My role there, I worked there almost 17 years. I started there at 19 years old, going to nursing school, and then switched to medical just based on where I thought clinical was going. Clinical was going down the documentation road only. So it was back in like 2001, 2002, switched, knowing our systems and programs were going to change our world. I just didn't want to be dead on my feet. I rather work on solutions to help enhance provider workflows. So I worked at the hospital as a physician liaison for many years, and then moved into IT sector area in training as a focus and communications. So at Heritage, we have, I primarily, my role for coming to Heritage a couple years ago was to implement a new EHR. We switched from NextGen to Athena Health and have, that was a huge implementation. We have over 50 different providers and clinicians that use the system. So we've had, I think that's, we've switched some on, switched some off. It's been kind of an interesting thing. So it's pretty much where we're at. Yeah.
Awesome. Thank you for being here, Alicia. It's kind of unique that we have someone in our very own backyard here local to headquarters on with us, as well as Laura holding down the East Coast for us. So thank you both for being here today. As I mentioned earlier, our third panelist, Helen. Helen's from Orthopedics Northwest in Yakima. She had a clinical emergency today, which, you know, we're all used to dealing with. So wish her well and luck today. And then we have the beautiful Samantha Lewis standing in for her. So Sam, if you wouldn't mind taking a moment to let everyone know who you are.
You bet. Samantha Lewis, like she said, project specialist here at M.I.S.T, also a NextGen certified professional in all 4 of their product lines, which is quite the feat. My healthcare career, I'm going to have to admit, started quite a few years ago at Blue Cross of Washington, Alaska in Mount Lake Terrace, Washington. They were down the street from my mom's, and she said, hey, why don't you go put an application in over there? And wouldn't you know it, I got hired for Medicare secondary billing processor, I guess you would say. And so kind of got my feet into the billing end of healthcare. From there, I moved to Minor and James Medical, which was an 85 doctor specialty practice that back in the day was on an old mainframe system. And I started data entry there, moved into hospital billing, ended up running the information systems for them for quite some years, helped them transition into NextGen in 2006. Was there for a good 18 plus years, didn't really think I'd ever leave. Then my husband and I decided to take an adventure, and we moved to San Antonio, Texas, to get out of the doom and gloom of Seattle. As beautiful as it is, you know, after 40 years there, you think we'd try something new. Ran NextGen for Sports Medicine Associates in San Antonio, and they're very cool because they're the Spurs physicians, which is, you know, quite the entertaining thing to do, is work with all those sports stars. And I actually was introduced to M.I.S.T back in Seattle when I worked for Minor and James, because they came on board and helped us do our first upgrade. So when I found out a few years ago they were hiring, I jumped on the bandwagon, and I've been with them for the past 7 years, and I'm absolutely loving it.
And I don't know what we'd do without you, Sam. She's the brains of the operation, I tell you. All right, ladies.
Hardly.
Thank you so much for sharing a bit about who you are. We're really thrilled that you're here, and again, thankful that you're part of the M.I.S.T community. I'm gonna take a minute. I'm gonna play a video here to allow us all to catch our breath, get a drink of water before we dive into panelist discussions. So this is ECS.
Frustrated with documentation slowing you down, pulling your focus away from the patient? Meet M.I.S.T, whose staff electronically filed all of the records for you already. We just need remote access to get to work. Our mission is to make a positive impact in the lives of clients through our knowledge, innovation, versatility, and networking. We've always strived to deliver whatever our clients need. From this, eChart services were born. Our US-based medical administration certified staff will remotely log into your document management system and file your patient records into your preferred categories. Our staff aren't answering phones, visiting with patients, or assisting other team members. Their sole goal is to file your records with 99% accuracy in less than 48 hours. Vacation coverage? No problem. We'll fill in for you. Still working on chart abstraction? No interface with your hospital? M.I.S.T takes on the data entry for you. Our model tends to save clinics 28% the cost of a full-time employee. For more information, visit www.mist-corp.com or call or email 877-874-6475, sales@mist-corp.com.
Wow, that video is actually somewhat insightful, Ashton, but is really just the tip of the iceberg. I'm curious, Laura, what clinical pain points has COVID-19 pandemic shoved to the forefront for you?
We had to, obviously, we shut down most of our practices, consolidated them down from our usual 26 locations down to just 2 primary care locations, 2 pediatrics, and we had our specialty location building. So we had to get virtual visits up and running really quick. So that was one of my major jobs. I thought for sure I'd have a mini vacation with this COVID and not be on my plate, but it didn't really happen. We were busy in a totally different way. Teaching our providers how to check patients in was quite the interesting journey to go down for telehealth. So, you know, just revamping everything that we normally did in our workflows with the patient coming in all the way to checkout, billing and, you know, coding and billing, it was totally different. So, and we had to do it pretty quickly. I think we did an okay job, but yeah, we're still learning to this day on how to get back up and running, what the new normal is. So I would say our pain points is taking care of the patients appropriately. So.
Very good point. Alicia, what about you? I know you guys rapidly reduced the size of pods, were very creative in getting patients through the doors during this awkward time.
Yes, we had, so in our state, telehealth hasn't ever been approved in Idaho. It was on the tracker to do a pilot because Medicaid was going to cover it, and we were going to pilot it in some of our clinic locations by payer. It was on my tracker for projects this next year, and then this happened, and we're primary care, mental health, and dental, and psych. So we quickly spun it up, telehealth, in 5 hours. I'm so proud of that because I've read every other place is like 10 or 11 hours, and I'm like, 5 hours. And we were in one room, and there was like 6 of us, and 5 hours to even educating the providers on how to do it. And then we had that afternoon, was like at 3:30, we were done. We had planned it, and we were starting it the next day. So we shifted like to 100% telehealth as much as possible. And then we had to build curbside kind of, like they're doing curbside food, curbside patient care in all of our clinics and locations, door screeners, switching. We implemented a new system of chronic care management. So overall, we did everything, that every area did, but our success is kind of attributed to campaigns, keeping the clinical staff busy even though they were at home and not seeing patients, and have them targeting certain populations of patients like hypertension patients, diabetes patients, pulling on our analytics to be able to say, contact this subset for this clinic and see if they need things. And then it's just sort of progressed as the state phases of reopening have allowed different things, and we've just gotten better at targeting populations, helping them feel safe, being flexible in how we deliver care, and then continuing telehealth. So, yeah.
Wow. Okay, good. I'm going to ask you about that in a couple of minutes, but Laura, I know that you sent thousands of employees home in a matter of days. What was turning, for example, your call center into a work from home call center? How did you accomplish that?
So we are an affiliate with Exeter Hospital, and the Exeter Hospital has the M.I.S.T team. So they had already been talking about, the work from home is such a big morale booster for any corporation. So they had already looked into the system's called Maraca. I think I'm saying that right. But basically a phone system. So once they started hearing what was happening on the East Coast, moving its way up, from New Jersey to New York, we just jumped on the bandwagon, bought a bunch of boxes. We actually put our call center at home. It took about a week, though, to do that. So we did have some people in the office answering the call. So that took about a week, just from making sure everybody had the right service provider speeds. So from internet speeds all the way to the hardware that they needed to make sure that happened. So, we actually had our referral center working from home also for the same about a week. So we haven't brought anybody back. We're still able to work from home. So actually I'm in my office today, but I haven't been in here. As you can see, the big stack of recall letters behind me. Again, we're opening up our endoscopy suite and doing our colonoscopies, and so we're just starting to bring things up. But I don't think the new normal is going to be working in the offices much anymore. So this has afforded us to get people at home and have a morale boost, and actually our productivity is increased with our call center. Yeah. So, obviously we all worried about that, just being in leadership to make sure that you don't have to babysit your people. So it's been really good, and our people have, anybody that didn't have things to do was redeployed to other different parts of the organization, hospital or within core, to do other jobs. So it's been, as horrible as it was, it's been a very positive outcome with our ability to work as teams and get, the patients taken care of, and so keep them busy. Yeah. So.
It is really incredible to see this turned into a positive for multiple organizations. Alicia, I know that you've been closely considering this as well. Will your staff persons go back into the clinic?
So there are some that won't ever. We just haven't determined which ones. I was just talking to Jade, our COO, yesterday, and the employee morale boosting, but we've always been really kind of innovative, or Heritage has always done a different type of approach, and it's not the standard traditional approach to work, but we did flip it to where people were remote if possible, like everyone that could be possible or could be remote was flipped to remote within a couple of days as technology allowed. But we are considering and evaluating all positions, every single one of them, to see if we are going to continue certain roles always remote for forever. It's kind of interesting. We were talking about, I just personally know our community hospital did a different approach. They did not send anyone home. Our community hospital didn't, they're kind of traditional, and they didn't feel that they wanted to have any of their teams be remote. I think some did, but for the most part, none of them did. And I know from working there for 17 years and, colleagues in the field that it's a huge dissatisfier because people are scared, our kids are at home, yes, we're essential workers, so we had daycare opportunities to take our kids and potentially expose them to the virus. I mean, so we've seen it really help our teams, provider satisfaction. We're going to do telehealth for hopefully forever, and we'll have providers that get to do telehealth days and be home, and that's awesome. So
that's amazing. One thing that really burns my heart and was kind of my mission earlier this year, Steph and Sam can attest to, is taking care of providers. Darn it, they've been accidentally abused, and so turning this scary negative thing into a positive and hearing a doctor say, "I'm happier, I feel lighter," is absolutely refreshing. I'm really excited about that. Laura, what do you think? Will your providers continue using telehealth after the pandemic has passed?
Yeah, we're not going to drop it at all. So we actually purchased Auto Health, which is part of NextGen's add-on software. So they're fully regulatory. They follow all the state laws and regulations that right now are not in place, but you know they're all going to come back eventually. So we'll be ready for that. We've had providers that haven't been able to finish their notes, in 5 days, that type of thing, and they're getting them done every day. They're seeing over 50% of their patients just on virtual visits alone, as well as, so every provider, we have 135 licenses, and every single provider is using it at a minimum of 25%. We have some providers that are using it 75% of the time. So they've cut down their need to see patients. Endocrinology is a good one. So they can see the patients, but they don't have to touch the patient. So it's been really good. And so we're actually going to be starting a committee for virtual visits and telehealth and just focus on how can we keep it alive, keep everybody happy, get the patients really educated heavily, that type of thing. So I think it's here to stay for sure for our organization. I don't think the doctors will let it go away. So.
Yeah, that makes me happy. I have to share with you all, as a parent, I was a telehealth patient with Lala earlier this week. It was last week. She woke up with strep throat. I called at 8:01. They had her a telehealth visit with her physician at 8:50 a.m. and I had her medication by 11:30. It was one of the best feelings as a parent ever. I was extremely impressed. It was a wonderful feeling.
That's great.
So talk to me for a second about revenue impacts and restructuring priorities. So I know that there's both sides of the fence, but Alicia, why don't you share with us about what's been good for revenue generation and what's been bad?
So the one thing that it's really crazy actually, because the first couple of weeks we were like in critical crisis mode to throw everything up quickly and not have a huge dip in encounters. Dental pretty much closed its doors except for emergencies, so that was the biggest drop. Our state did more reopening, so 2 weeks ago we started doing some hygiene appointments, and we were up to 50%, and then 75% last week. Now we're starting full capacity Monday next week with dental, so that was the biggest kind of loss area. And then honestly, just from the encounters where we were at this time last year, we're only 1% below now because of all of the efforts, 1% below. And then, which is shocking. I don't even know, if I could say what the recipe was. Really, I think we have a large volume of patients to see, a lot of people that were on the waiting list, and proactive teams calling and outreaching to patients from all different areas. We had automations in our Athena system, which I every week for 7 weeks, I personally put the campaign and said, send it to 21,000 people. Or, which were the patients we'd seen in the last 12 months. But chronic care management, I think we can say that we implemented that April 6th as a strategy. We planned it already, and the timing was perfect. We have a huge Medicare population, and they qualify for chronic care management services. And we just targeted are Medicare patients with a secondary insurance, and that means they wouldn't have a copay. And it was basically like a person to call them at home and just talk to them about their conditions, their medications, and they were home because they were home with the home orders, and they were our elderly patients, and we have over 700 enrolled since April 6th, which is huge, and it's monthly reimbursement. So
that's incredible.
Those were kind of our strategies. Yeah.
Wow.
Really lucky. I feel like we're so lucky. I don't
That's really great. Laura, what about you? What's the good, the bad, the ugly?
I think the good was we give the option of virtual and telephone right now. We check our payers on a daily basis, and we get reports out from finance if anything changes from the payers. So that's been good. The bad is our patients are still very scared to come back into the office. So we're finding that's very difficult for our surgical. We have a bunch of surgical specialties. So I think that's going to take some time and some trust as to, so we're getting it all out with marketing and how we're like screening everybody and, putting little videos out in the community, using Facebook, leveraging that, some Twitter, just trying to let everybody know that, we're only doing this for the safety of our patients to make sure they can be seen. So we are not up to capacity yet. We haven't reopened all of our primary cares yet. They'll be all open in mid-June. We also we've been using Freesia, which is a vendor that allows us to do zero contact check-in. So that's been very successful, and patients seem to like that. It's a lot of, so we kind of scrambled to try to get whatever we could to make the patients feel safe, and they've so far, it's good, but, it's going to take some time for people to want to come back in and feel that safety of being safe out there, so.
For sure. Very interesting. This will be an interesting summer for sure.
Yeah.
Helen, who wasn't able to join today, she runs an orthopedic clinic, and for her, the lack of elective procedures was just burdensome. That's a huge revenue generation for an orthopedic clinic, and so one of their top priorities in opening in the past couple of weeks is just getting those rescheduled. They're running EPM reports like crazy, and just getting those back on the books. So it's interesting, but I'm happy to see that there were pluses and minuses in this situation. So, all right. Unless you guys have any questions, we'll take it back to Miss Stephanie for a little intermission here. She's going to show off some tools for us. So unless there's any other questions, I'll let Steph take the wheel.
All right, thanks, Ash. Now to get us talking about tools for success, I want to take a few moments to show off some of my favorite tools. The Next-Gen Accelerated SOAP template by M.I.S.T with Dragon Medical One. And I'll go ahead and share my screen. All right. Can everybody see my screen?
Yes.
Okay, great. This is the SOAP Scribe. I try to say SOAP and Scribe at the same time. This is the SOAP, Scribe, and M.I.S.T order sets all in one. So if anybody has questions, just please chat in the chat box and we'll answer them accordingly. The reason a visit panel is optimized with the additional and manage section and comments field section. So there are free text fields for reason of visit, review systems, physical exam, and then even assessment plan down here. So you'll see that later as I go through the demo. It's great for Dragon users or scribes. It's a highly flexible template and allows for any kind of workflow. So for all my Dragon users today, I'll be using Dragon Medical One. So I'll go ahead and start here in my ROS section. Patient complains swelling the feet and is worsening, comma, and difficulty seeing out of left eye, comma, with mild redness and tenderness. So enabling the scribe template adds these narrative fields to your SOAP template and allows the providers to focus their attention back to the patient and get that quality time. It allows the provider to dictate the narrative and then work with the team to generate the supporting documentation. All right. My diabetic ROS. Positive for excessive swelling in feet. Positive for excessive buildup in the macula period. Accept default. All right, now I can move down to physical exam. My diabetes physical exam. Dry, 2 lacerations on scalp but healing well. Next field. Swelling in the left eye, excessive fluid present. Next field. Significant for lower extremity numbness throughout. Next field. Significant for lower extremity swelling worsening. A1C test came back at negative 6.8%. Now we're moving on to the order set template. We've created this so the providers can order everything in one place. My provider, so by clicking here, I can go and pull up my provider's favorites button, and then clicking the diagnosis box will allow my provider to select from their favorite diagnosis. So I can click this. The patient has diabetes. They can also use encounter-based diagnosis or IMO. This option here actually allows for up to 7 additional diagnoses and plans for a total of 8. And then you can see here we've added our patient plan, provider plan, and impressions. Now I'm ready to drop in my order set. Unlike my plan, there are no categories to set up. A diagnosis does not have to be tied to the order set. You can simply select and then get back to the documentation. So I'm going to go ahead and select the diabetes plan for this patient because I know this order set has everything I need for the patient. Perfect. So my diabetes order set has dropped in my labs, immunizations, and even medications and also referrals. The provider has the freedom to alter these templates and save them as a template default of their own. The little circles here that you see with the lines through them, you actually can delete the one item here if I wanted to delete this lab, or you can go over here and delete the entire section. So let's break this down to each of these segments. We have our patient plan, our provider plan, and then we have our impressions. So if I want to just dictate in here, I can. Diabetes is unstable and worsening. Labs are actually pretty neat. It'll allow you to add up to 12 labs. You can add one on the fly as well. And this can be done through most frequently used, encounter-based, and all labs in the compendium and care guidelines that are set up as a lab and show you what the labs are due for that patient. If I wanted to go ahead and add a CBC, I can click that, add it there. You can also schedule a future or recurring order. So if I click on this calendar icon next to it, this will pop up, and I want to go ahead and order a future order. I'll go ahead and click future order, set it up for next week, click OK, and then accept. And then now my little calendar icon has turned red, and that lets me know that it's been ordered. Diagnostics, as you can see, I have 3 available. I also have 3 radio buttons. The top 50 diagnostics ordered by the provider in the system, and then the patient is what do I order for this patient, diagnostic speaking, and then all diagnostics available. And if I wanted to go ahead, I can add another chest x-ray. Immunizations, I have 6 available, and with the radio buttons, again, I can search through my top, my patient, encounter, all, and then favorites. And this is all of my favorite immunizations from the order module. So you see here, I have ordered a flu shot for the patient. My counsel all button will check the box next to the immunization ordered, and then my vaccine for kids checkbox for Medicaid children. Moving down through this section covers a multitude of items for us, anywhere from DME to patient ed to follow-up. And this does check the box for meaningful use, and that is ordered under the patient education. And then getting here to the bottom, we have the medication section. The M.I.S.T order set sits with 6 medications with current real estate, but we can alter this or make customizations. This pushes all the way to the med module, and then from there awaits to be sent off to the pharmacy. The provider can also add any procedures for the day. So for this patient, I can go ahead and add an ECG. And last but not least, we have our referrals section. We can push out referrals all the way. And if everything looks good for this patient, I can go ahead and push everything across, and it'll go back to his origin field. And then I can click place order. My medications to acknowledge, I can go through, hit acknowledge. There are actions available for the actions ordered, like tasking and asset order entry pop-ups. Save and close. Perfect. Medications module pop-up. Just for that, I'll go back. We can also add the order set printing panel for lab requisitions, forms, or patient referral forms or diagnostics. And then going down to my assessment plan, we have another free text field here, and if I wanted to add in another note, I can. Patient is due for physical within the next 6 weeks. And that is it for our Accelerate SOAP template. Does anyone have any questions? No? Okay. Great. So, Sam, what are your favorite tools to help clinicians work through their documentation?
Well, I've been implementing EHRs for a long time, and as we know, that's usually a pain point with physicians. So I'd have to say, as far as tools that M.I.S.T offers, it would be Dragon. It's one of the tools that when we hand it off to a provider, they actually smile. You know, you don't get the grumbling. It actually, it makes their life easier, I feel like. It's a pleasure to bring them on board with something like that when you know, versus an EHR where they're, oh my gosh, so many clicks. And when I think about innovation library, it would have to be the order sets like what Stephanie just demoed, because again, it really does save clicks for the physicians. It allows them to easily order without having to go through 6 or 7 different templates to hit labs, diagnostics, referrals, medications. So I haven't actually worked with physicians when I'm doing the implementation for that. I'm usually working with the information systems department. But as we know, for the people that are supporting our physicians, we know when we see a product like that how valuable it could be. And so those, you know, and I'm kind of biased because I do quite a bit of work on that template.
When we were building that template, I called Sam Hermione and her counterpart Melissa Harry. So Harry and Hermione, innovators over there. But Laura, I know you're actively in the throes of implementing order sets. What's that experience been like?
So we should have been live already, but this whole COVID thing put a stamp on that. So we are working with some of our leadership providers on our provider approval committee. And we're going through service level agreements that we have set up between our primary care and our specialty offices. So that's really how we're focusing our initial build. So they've seen it just recently. So they're getting excited. But we have so much on our plate right now. As you know, things have totally shifted and moved, but our goal is to get it up and running, hopefully with M.I.S.T help, but until travel can be lifted, but we'll see. By the end of September is really our goal. By this fiscal year was our goal to get those live. So that's our hope, because we also have to start working on this AUC thing that maybe that'll be pushed off another year. But you know, just different shifts now that I feel like we've literally lost like 3 months of work with this whole COVID stuff. But it's been good. It's feedback that we're getting on how it looks and the feel of it is very exciting. So the providers, anytime that they can save a click, then it's a win. So we heavily use Dragon also. So.
Alicia, I'll bet, I know you came from NextGen and went to Athena, so I'll bet you actually recognize quite a few of those components in the M.I.S.T order sets.
Yeah.
Athena is some of the inspiration for that. But let's talk for a second about this what's in your toolbox as far as M.I.S.T tools? And
well, we're actually having working with M.I.S.T right now to do assessments for our front office, back office, and providers. We're having Monica actually come on site I think it's about a month away, last week, I think it's the last week in June, and do kind of become our not part of our staff kind of assessment of how we're using the system in Athena and any opportunities we have. And then we'll follow up and do kind of some analysis of the results of that and do some focus training for each of those 3 tracks. So front office, back office, and providers. And in addition, we're pulling reports from Athena to be able to understand from providers' perspective encounter close rates, how much time they're spending, if they're using text macros, if they're doing ticklers, things like that, since Athena has a lot of automation opportunities that are not always being used. So since we're about 2 years in, well, maybe we're about 2 years into Athena, it seems like it's about the time. And interestingly, it seems like the right time with the changes, like with patient appointments, and it seems like education is a really good time right now for different reasons. So
good, that's awesome. Laura, you mentioned something that made me want to ask this as well. Part of our being partners is so that we can support you and take some of that other shuffle off of your plate. So I was wondering if you'd talk for a minute about our e-filing partnership.
Oh, sure. So we started, so core physicians, we have currently in our database, I think it's just over 8 terabytes of data. So you can just imagine how many pieces of paper come into our organization from a primary care standpoint. You know, we're only 29 miles, 32 miles from Boston. So we have a lot of patients that go to specialties in Boston. We have Concord, New Hampshire, also is close by. So we have a lot of, unfortunately, stuff going outside of our system. So we had, I believe Ashton, it's been a long time, 6 full-time scanners centralized that we were, having to pay and shuffle around courier service to get our papers into one central location. So we started complaining to M.I.S.T actually about being backfiling and stuff like that. So talking with M.I.S.T, and this, so it's been about 7 years. I believe you guys have been e-filing for us now. So we actually scan the documents over, and M.I.S.T then files them back in. The rate of accuracy is a lot higher than what we had with our own people doing it, whether it be for speed or what have you, but we do really well. I'm in partner with M.I.S.T, and I have a contact over at M.I.S.T that I work with every month to say how's it, or if we're having issues. If things get behind, we put a plan in place on how to catch up. So it's really been a wonderful service that they've given us, and it allowed us to put some different focus on when we're scanning, should we be scanning it instead of just scanning and filing it all, and some of it, and then you end up having large lost page batches and dealing with all of the stuff that shouldn't have been scanned in the first place. Done a lot of duplication work. So that's how we've been using the e-filing, and even the filers themselves have become like nice little how you doing type people to our employees that are going through the batches to make sure they're all filed. We don't see them face to face. I have no idea what they look like, but I know their names, and feel really comfortable being able to talk to my point person to say, hey, Susie, can you just talk to her about this because it was filed wrong, or if we have a new type of form, I just send it right over, tell them where we want it, and we've had no issues. So it's been a really positive.
I saw a couple of COVID-19 document types come over in the past couple of months to add to your workbook. Yeah. That's awesome. Well, fantastic. Steph, do you want
So
to
we've
wrap?
Yeah, that sounds good. So we've heard all the change that the pandemic and stay-at-home orders have inflicted upon our businesses. So I'd like to hear what our panelists are doing today to stay on top of day-to-day. Ashton, what's keeping you sane now?
That's actually a great question. Some days I don't know, to tell you the truth, but creating a morning ritual has what's been keeping me sane. I know that there's a lot of way people do it. Alicia actually gave me some great advice as well, but make something that's normal, make a new routine. For example, I wake up, I do a little bit of exercise, a little bit of devotionals, get my coffee, read through my emails, and then I go ahead and get started with my day. And having that ritual helps me set my expectations and get ready for this change in workflow throughout the day. My 3 and 5-year-old, 4 and 5-year-old are home with me, so that's been an adjustment. But again, just trying to create that sense of normalcy and a schedule really helps us attempt to stay on point. So, Alicia, what about you? What's keeping you sane?
Yeah, kind of the same as that. I think just holding on to what you did before all of this happened and continuing to do the things you still can do. Like I run, so that didn't really get affected. That was the one thing that didn't get kind of pulled away, and it didn't get changed. There was no change to that. So I kept doing that, and actually I've recruited several new running partners and teaching people to run, and it's kind of silly because like, it's always been there, but now they're looking to do something else that's not been changed or affected in some way. Today, in fact, running with a neighbor lady, we remember like going through this in the very beginning, 8 weeks, whatever, it's been a couple months ago, and no one would have ever thought that this would have happened. Like back then, if you all remember that feeling in the very beginning, you're like, this is unreal. Like, no way the schools are going to close. No way that they're going to, it's going to be done the rest of the year. It seemed almost like not even real, but it feels real now. So we've adjusted. It's like not that big of, I mean, it is, but it's not that big of a deal. I mean, tomorrow's the last day of school here, and we've made it, and we're adjusting. So we're more resilient than we know. So that's kind of how I'm surviving. I'm really positive, so that helps. But there's a lot of, our mental health side has seen such an increase of mental health issues and concerns, but definitely holding on to what you used to do that still you can do continues to make you feel like a little normal, till it gets normal.
The new normal. Laura, what about you? What's keeping you sane, or any tips to stay that way?
Well, since working at home, I used to work from home for 5 years, and you end up working a lot more. So I've tried to balance that. If I work 7 to 5, then that's it. Try not to get onto the computer too early, and then try not to stay too late. So that's, good work balance at home. The other is keeping the normal, like waking up at the same time we did before, getting breakfast done, and being ready to, like on my first meeting at 9 a.m. or whatever. So I try to keep all of that. The only thing missing is the commute. So during the commute time, I do log in and email, stuff like that. So I'm trying to keep some type of normalcy.
Yeah. Sam, what about you? What's keeping you sane, or do you have any tips for us?
Well, we work from home when we're not traveling, and I think the hardest part for me is not traveling. I'm just so used to not being home all during the week. I mean, working from home is not a problem. We do it a lot. But what's been keeping me sane is, now that I am home as much as I am, is trying something new for dinner. I'm gone, Monday night, Tuesday night, Wednesday night, Thursday night, getting home Friday night late. I don't have that time to cook, so we've been trying all kinds of new desserts and all kinds of new dinners and watching the food shows and, just giving it all a try. And I think that's kind of what's been keeping me sane, making sure I get up in the morning and actually put some work clothes on and brush my hair before I sit down at the computer, because it gets easy to fall into a rut like that. And then just getting up and getting outside at least once a day. I mean, even if it's just, I have a ritual of just walking to the mailbox and back, get some sun on my skin, get out of this you know, I have a screen on my window, so my office tends to be dark to keep it cool in here. So it's just nice to feel that sun on your skin too, even if it's only for a few minutes. I look forward to it.
Yesterday, I had back-to-back calls from 7 a.m. until 5:30, and I did the same thing for my 3 to 4 p.m. I just said, guys, I'm going to sit on my patio table. I need some sun on my face. And
Exactly.
yep, that worked out all right.
Nice.
All right.
It makes you feel good too.
How many rolls of toilet paper do you have left? How many rolls of TP?
We have a ton now because it quit being off the shelves at our Walmart at least. So I'm not stocking up, but I never did stock up. I mean, for a while there, my mom would get a 12-pack and bring me 6 because she was old enough to go in the store early and grab it.
Laura, what about you? TP shortage real?
No, I go to BJ's normally, so, you know, we get the big case of like, I don't know, 38 or 36 rolls. I haven't even had to replace any. Laugh about it.
You guys were well prepared. Alicia, how you doing on toilet paper?
I'm not one of those that stocked up. Not in me. I'm not in that category. I tried to order it online, but like we worked it out.
Yeah.
I did order it on Amazon, guys, and I'm not even joking. Hank got one of those boxes.
He's been getting into everything.
I know, he's in big trouble.
Yeah, he likes the packages.
Yeah. Well, all right, Steph, go ahead and take us home real quick.
All right, great. Well, I want to give a huge thank you to all of our panelists, Laura, Sam, Alicia, and our moderator, Ash, for sharing with us your experiences and opening the door to some collaboration in the M.I.S.T community. If you've all enjoyed the session, go ahead and tell me in the chat box. While we are doing that, we can take a last of the few minutes here to ask any of our ladies from Core Physicians or Heritage Health any questions that come to mind. Go ahead and drop your questions in the chat box, and we'll see if we can share a few more of those moments of dialogue.
All right. You guys are awesome. I can't thank you enough for doing this. This is great. It'll be up on YouTube in a couple of hours, so just give me a few, but I can't thank you enough. This was a very special experience, so really appreciate you.
Thank you.
Thank
you. Thank you, guys. Have a great day.
You too.
Bye-bye.
Bye-bye.